So I saw my oncologist yesterday after my upper body CT scan, and the results for that are really good. There's no cancers anywhere that they can see. My hernia is a little bit bigger than last time, but that's okay. Nothing to worry about, actually. Excuse me. And I have to say, every time I see my oncologist, I am so grateful for her. She listens. She really makes sure that my feelings or what I am concerned about is really looked at. And she is one of the kindest, most soft-spoken people that I've ever met. And she's just incredible. So I'm so grateful to have her as my oncologist. She is concerned about the leg, obviously, and keeps saying that because there's so much damage there, it is going to take a long time to heal. But a couple of things that we actually talked about this time is my physiotherapist from the beginning has always been hesitant in doing stuff because it's been back and forth with yes, do physio, don't do physio, do this, don't do that, do all these things, but be careful. Like, there's just so much of stuff that has gone back and forth. And with everything that's going on in the leg, he's never actually dealt with anything like this. And I had to be very careful. So it's been a little stressful, I think, for both of us. But I mean, I've been doing all the exercises and all the stretches and everything else, and still continue to do all this stuff. But there's been like, go to physio, stop physio, let's give it a break, and all this kind of stuff. So what we decided is that I'm getting referred to the physio at the Cross Cancer Clinic because that's all they deal with, patients with cancer. And it might just give a little bit of a different perspective. Now, she says she thinks I'm doing everything already that I'm supposed to be doing, all the exercises and all my physio stuff and all the stretching and all the extra stuff that I'm doing, like red light therapy and just the massages and all the different things. But maybe we can, with the physio at the Cross Cancer, maybe they'll see something or can suggest something or that might be a little bit different. Who knows? But she just thought it'd be a good idea to do that. So waiting for that appointment. She's referred that. Another thing that she suggested is to talk to my orthopedic surgeon about hyperbaric oxygen therapy. Now, that is a huge commitment, and lots has to happen before I'm even accepted into that and be able to do that. And it might be more of a pain clinic thing, where if I get to the pain clinic, that's kind of be one of the things that they might want to do. But to talk to the orthopedic surgeon about it anyway, just his thoughts on that. The first thing that has to happen with that is I have to make sure that there is no cancer anywhere. So that's where the PET scan would come in, where they would test that again, do that again, just to make sure. You do not want to be going into oxygen therapy if you have any type of cancer, or if there's any slight of it, because that could escalate it. So that's something we don't want. But this is an idea that we need to look at. She feels because there is oxygen, insufficient oxygen in the leg and insufficient blood flow in the leg, and could be something that might be helpful. She is ordering a full leg MRI because we just need to see what's going on in there. Besides the fact that I've got all the issues already that are going on in there and the scar tissues and everything else. With the ultrasound, she does say that I have radiation fibrosis as well. So that just adds another level of everything on top of that. Explains a lot of the pain, just everything that is happening. And since I have all that other stuff happening already anyways. So that's kind of what's happened with that. So I do have to call the orthopedic surgeons and talk to him about that. And then we'll see what happens from there. Still doing all my exercises as much as I can when the leg allows it. and just have to keep plugging along. So that's kind of what's on the burner now. So hopefully physio will at the cross will start sooner rather than later, and then who knows, maybe we can figure some extra things out that I could be doing, or maybe I'm doing too much, or who knows. But I think it's a great thing to do, just for a little bit of a different thing, I guess. Yeah, I still lose my words. But anyways, so that's kind of what I wanted to talk about, that just so I have it on recorded, and yeah, my little update. So hope everyone has a great day, and thanks for listening.